Gambia's President Adama Barrow on Friday made his sixth national address since the outbreak of the COVID-19 pandemic in the country, saying the sudden rise in new cases and deaths from coronavirus is sad, and that his government development agenda has been drilled by the virus outbreak. A surge in cases in July and August has ravaged the country's health and economic sectors. President Barrow said the COVID-19 pandemic has challenged our health system and undermined economic growth, adding that it was important for the public to follow coronavirus emergency rules to help stop its spread. Barrow did not address calls to provide full medical packages to frontline workers and other urgent demands from civil society and frontline workers, like making available basic medication in the treatment centers. Instead, he said people need to unite in the fight against the virus. Since March, the Gambia government has made a series of emergency rules, most of which hurt businesses and daily wage earners and did not prevent a rapid rise in the confirmed cases. However, President Barrow said this was obvious as we live in unusual circumstances, which requires unusual, urgent and decisive action. Now, more than 1,600 people in the country have contracted the virus and more than 50 deaths confirmed. Several of the country's doctors, nurses and other health workers have tested positive for the coronavirus, creating a capacity gap for an effective response to the pandemic. Health facilities are struggling to cope as staff test positive or fears self-isolation. So that is the President's statement on Friday, and I'm happily, of course, to say that we are joined on the platform to discuss on the President's address by Nyao Koma, who is not new in this platform. Ñu waxtaan ak moom li nga xamante ne mooy président bana bataaxal wala boog message bu président bi amaloon li nga xamante ne mooy of course waa réew mi ci li nga xamante ne mooy tolluwaay bi ak taxawaay nguur gi. Ñaaw ñu wax la thank you very much for joining us. ñu nuyu la xam nga ñu bàyyi la nga nuyoo ñi nga xamante ne ñoom ñooy seetaan right now.
Sorry, all the time dama dey put face masks off because guidelines you might read, it is more serious when you are talking, spitting in your face mask than talking loud. Lengen day definitely is very good social distancing be.
Wow.
Why? Because Nyomadej is everywhere in the world, including WHO, all the presidents and the prime ministers in the West. When they are not talking, they put the mask on. When they are talking, they put it off. So, wow, bobu yen dangen ragal rek stigma bi la rek comme niñ ko dé waxé. Thank you. I'm very happy and delighted to be here today to discuss on issues pertaining to this pertinent issues in society, that is COVID-19.
Indeed.
Obviously, it's everybody's business. It's apolitical. This is a national issue, and it depicts national effort to defeat this pandemic.
Absolutely.
So I will be very glad to discuss the most important issues in this speech and whatever we can do to cope COVID-19, because definitely it is a menace.
That's why it is, and we have limited time, so we get straight to what we will be talking about. Of course, like I said, the President, for the sixth time, addressed the nation on Friday, and of course, this is more or less after a demand or a call from many Gambians, including civil societies and other people. Tell us, what did you make of the President's message to the Gambians?
Definitely, I think it is late. And in the manner in which it is done, I'm not happy. We need an interactive president. Because you can see even by the
interactive
president, when you're giving, it should be a live feed. Journalists like you should be invited to that forum. Even if it's going to be a limited number, as per WHO guidelines, it should be observed. At least even if it's going to be a limited number, so that pertinent questions should be asked to the president and he should be able to answer to the country.
Yeah, but this was an address, not a press conference.
That's why I'm saying it should not be an address all the time. That's why I say it should be interactive.
Okay.
Because when you mean it's an address, do you know when it was recorded? It is not a live event. Nobody can, because even looking at what was said in this speech, if I can remember, the date told he was talking about in the speech was not 50, it was 40, if I can remember. That means that he was not current on the statistic because it was Friday, and by Thursday the death toll has passed 50. But he was talking about the death toll 40 on that day in the speech.
So you're trying to say
it was not current, because if it is current, you would have talked about 50.
Perhaps it might be a technical error that can be excusable.
Yeah, maybe.
But on the message itself, what's your...
On the message itself is
Yes.
50.
Yeah, what I'm saying is, what do you make of the message that he...
That's why I'm saying the
Yeah.
message it should be interactive, because one, the government should not always be giving addresses talking about COVID-19. It is more like of explaining what have passed than the plans that you have to cope COVID-19.
You did not hear anything new?
I didn't hear anything new. You talk about what it has done to the economy that has already been done and is still doing it, and it will continue doing that. You telling us the curfew, people were very compliant. The Gambians are law abiding because everyone to save your life is like run for your life. So before even 10 o'clock, the streets are that clear. It is also, notwithstanding, you will have some elements who are very stubborn. They will tend to break rules. Some of them, I don't blame them, because there are many homeless people also. They sleep on the streets. So if you deny them, they will one day have to roam about and create that diversion so that they can able to have somewhere to put their heads down. I can understand some of those. What the serious ones are always in before 10. So when you talk about that and other issues,
before they will come in, would it not be surprising if you say it has been an all same story from the president, and we are talking about the 6th time he's addressed it since the outbreak?
I think we had discussions here, and I was talking about how serious the government is not taking this COVID-19. Definitely, if the Gambians fail, the government fail us more, because from the first day onset, when we know that our neighboring country had COVID-19, when we were COVID-19 free, we didn't have that coming from the UK. The porous borders and the uncontrolled borders should be controlled. What are the security forces doing? You have the PIU, you have the immigration, you have the army, you have the navy.
Yes.
You have the navy and you have the Republican Guard. Apart from that, you have the prison services and some of these other sister forces who are not doing virtually anything. Even the GRA, their enforcement department, can be utilized. Look at those vulnerable border entry points that are so porous. Put them there on patrol at intervals to control the in and out of people coming from Senegal. Step one, you will close the borders immediately. Yes, notwithstanding, relevant and essential goods can pass through, but make so close the border for any other business. But that is not happening here. Like your colleague has said, people are going in and out the way they like. Senegal, Mali, and how can you control the virus? Because this virus is always taken from one area to the other. People are carrying it. When you are restricted to an area, the tendency of you spreading the virus is very minimal. But when you move, that is what the COVID-19 virus likes.
Okay.
People moving from one end to the area, not controlled, and we are not observing. Like he said, I said it here, the social and the economic impact of COVID-19 is so huge that you have to have packages and stimulus packages.
And the president has spoke about that in his message. But Julde, you come in now and then...
I just want to comment the president's message. Of course, he talked about, the economy of the Gambia, how it was affected due to the coronavirus. He spoke of the need for people to unite in the fight against COVID-19. But in his speech, do you think that the president was able to address the main issues that are affecting people, especially during this pandemic?
That's what I'm saying, Julde, here. The president is not addressing any major issue. We are united.
So what are the major issues according to
when you talk about the economy, what is the government of the Gambia under the leadership of President Barrow planning? What stimulus package do they have for the crippling economy? What are the diverse ways that they want to implement to help the economy? That should be outlined. We should know. The health sector, if you look at the frontline workers are most affected. What are going to be the improvements that you're going to do to make sure that you protect the life of people who will serve us? The health system is trained. Because I told you here, Gambia is not endowed with much of the medical experts. When you go to the dialysis unit of the RVTH, maybe you have only 1 or 2 doctors. Imagine if that one contracts coronavirus, how many people are in line every week to be doing dialysis because they have kidney problems? So you will see people will die. I also requested before in a program here that the government should call for help outside. Let them be provided with some experts from other countries who can help.
Which they did.
Yeah.
They
you understand?
requested from Senegal for support.
Yes, not only Senegal, I say the outer wall.
Yeah.
Like, we have a relationship with Cuba. Cuba have more trained medical doctors than any other country in the world. Because it is like mandatory in Cuba, when you finish basic secondary school, you have to undergo medical training. It is like a system in Cuba.
Yeah, but
Do that, let people come up here and boost the medical system. Thirdly, you can even put up regulations that will also make sure that even these face masks we are using is from this surgical face mask we are using is from pharmaceutical companies. What can you put forward that the pharmaceutical companies also can chip in? Because they've been making profits for 15, 20 years. Now we are in the midst of a pandemic. What can you do to reduce the price of this face mask so that it will be available to the ordinary Gambians? What are the discussions that you are having with the business? Let the price of foodstuff come down. But now you are saying, after even this regulation, before, when the regulation was there, you can buy a bag of onion for like 475. But today, about 800 or 850 in some areas. What during this pandemic, what is the government doing about that? Rural Gambia, yes, we are in a farming season, yes. Yeah. What are you doing to boost that farming system? And still now, because of the restriction, these lumos or weekly markets are still closed.
Yeah,
because it doesn't make sense for you to leave this conventional markets in Serakunda open. When you talk about social distancing, when you understand the system of the lumo, it is more social distancing in the lumo than in our conventional markets. Because in the lumos you have sectors. When you want the cattle, you go to the cattle area. When you want like maize and these agricultural products, there's one area that they sell them. When you want vegetables and other things, there's one area they sell them. You know, and it is weekly. So you look at the impact it will have on their life in rural Gambia. So these are some of the things I'm talking about. Even the telecommunication companies should be assigned. At least you want people to stay home at certain areas. Make internet free from 10 o'clock till morning for all these providers. When you have a Gamcell SIM card, you have unlimited access from 10 to the morning, then you close it. Yeah, this is another way of keeping people home. Because if people are busy, they have their gadgets that they're using, they have internet, but what are they contributing?
Yeah, but you are talking about those are part of government responsibility, responses in helping, supporting the public, whatever.
Yes.
But we have also seen the government coming out with a package supporting Gambians. More than 500 million was disbursed to support Gambians, and I think that was the good step from the government. And the president is talking about the country's economy is affected, and you might find it difficult to government to do some of the things that you are talking about.
What I'm telling you, my gentleman, government is not a periodic thing; it's an everyday thing.
Yeah,
COVID-19 should not be a periodic thing.
Yeah,
the planning for COVID-19 should not be for only one package. When the government organize 500 million and give a rice package to the Gambian people, it should not stop there. Why people are disappointed with the response of the government, because it should be a continuous thing. We should be proactive. The trajectory should change as the COVID-19 status are changing. Yeah, but we are complaining before. We had maybe 100 and something cases.
I was going to ask Nyauru, don't you think also the situation of the COVID-19 pandemic will dictate on how the government will respond to certain issues?
That is what I'm saying.
Yeah.
I say the trajectory should change with the status quo of COVID-19.
Yeah.
But it's not happening. It is not happening. Now, for instance, I will cite an example. There is an overwhelming people getting infected. What is the government doing in erecting? Like Akin centers, that if the hospitals are filled, the beds are filled, where are people going to be quarantined and isolated?
Actually,
like in other countries,
at the stadium.
Yes, I said it's not only be restricted to the stadium, because that also will be accommodating 100 beds. You're talking about an infection rate of 180 minimum per day, or in excess. People posing positive. If you allow those people not to be isolated and be quarantined, you leave them to go home, there is a tendency they will also infect more people. So what are the measures? Even if you want to self-isolate some people in their home, what is the condition in their homes readily available for them to self-isolate? Those are things that they should be always foreseeing. It should be a daily routine thing. Should not be like we 500 million and we've been complaining. Even the National Assembly members have been complaining in the manner in which the money has been expensed.
So in essence,
because there is no clarity in it, they've been talking about it. You say 500 million is no small money. When you look at the Gambian budget, the entire budget for the whole year is about how many billion? Now we have passed 1.5 billion only for this COVID-19, and it should be used on specific things, not the entire budget of the country. It should be mainly on health, and buying equipment and containing. You've said it here. The statistics is saying 2% mortality rate in Senegal, 3.4 in Gambia.
Yeah.
You saying there's more life in Senegal and it started there and they are more populous than us. What is the reason? Because the government acts swiftly and they implemented things that they need to implement. They're putting on this testing continuously. But whether we even have enough gadgets as to the end of the month, we don't know.
Okay,
These are things that you should come out and clear to the public. Also, the stigma and the trauma that goes with COVID-19, you should come out at least stabilize people.
Yeah, this is what I'm...
So that give them the psychological belief that the government is doing something. Yeah. We are planning this. That's why I say the government should be saying to people what they plan, not to read to us what have passed. They are reading curfew, the restriction, the economy. We all know that it will have an impact on the economy. It has done. We will continue doing it.
Now let me
but
ask
what
you,
are our plans? Can you tell me in this speech, you've seen anything that is planning forward?
Yeah, this is what I'm... Now, let me ask you. Now, do you think the president was ready to speak to the nation, or is it because of Gambians were demanding? It's a pressure. And he felt that I have to come out now and talk to the Gambians.
It's disappointing. This is why it's important to have a good leadership. Nobody should compel the leadership to come out and talk to people. That's why I say it should be more interactive.
So now,
even you cannot do it like weekly, but bi-weekly, every 2 weeks, you can come up, talk to the Gambian population. I have sat up with my cabinet. This is what we discussed. We want to implement such and such regulations. We want to help the Gambians.
Are you saying that
he is compelled? Of course, yes, we all know.
That's what you're saying?
Yes. Why didn't he come out from March to talk to the country? It only happened. All the time, it will always happen. Even the first one, it happened when people started rumor mongering. They started saying the president is sick. The president is not even well because the vice president has contracted coronavirus. Maybe the president is also positive. They're saying it's negative. People have started spreading the rumors. They've started writing on their walls. Everybody is seeing it. Maybe the media unit at the State House saw that and say, Mr. President, it's high time for you to address the nation. That is sad. It should not have been like that. Okay. It should have been a duty for the president to be addressing the country even bi-weekly, every 2 weeks, and address your country. And it should be live and interactive that whatever you want to discuss it with the media. They know what is happening around town. Because I will see EYEAFRICA going to places, picking up feeds, that is live feed, attending some of these burials, putting it on. See that. What do you have in plan for people? What do you have in plan for Gambians, economic-wise? Health-wise, and what do you want to do for the strained health system?
In conclusion,
finally, I want to come here.
Yeah, before you go to your final, Jules, anything else you want to ask before?
It seems like we are all you're just looking at the government and the responsibility that they have, and of course there are failures in terms of the way they tackled COVID-19. But how about the responsibility of citizens in this coronavirus? Do you think that citizens are really also helping in terms of containing the spread of COVID-19 in the Gambia?
That is a well-structured question, and I would be happy. The citizenship will always emulate its leadership. They are saying some people are in self-denial. When the president's inner circle, some of them are in denial of the virus, and it went viral. People are seeing the video, they are seeing the extra, they are hearing the audio. They are in the president's inner circle, and they are in denial that there is no COVID-19 in this country. That's why I say leadership is important during these trying times. People have to be serious. People have to know that this is serious. It is a life-threatening disease or virus that it can take your life anytime, especially people with underlying conditions. You don't need to make it too easy for people to think that it's not existing. You don't not to make it too serious that people think that even you catch it, you will die, or when you have it, you cannot come out and talk to people and go and be cured and recover from it. Even you should not be cured, people are recovering from it. So you should be in between. Make sure you warn people, let them be careful, but also give them hope that there is hope. And it's only leadership that can do that. But not all the time waiting for people to compel you to come out. No, that is not the way it should be done. Gambia has to pass through these stages. And what you're saying, some responsible citizens also call on the government, especially political parties, to sit up, because this is not a political issue, it's a national issue. Let's put heads together and make sure we have a common stand on fighting COVID-19.
Yeah, but the president has called for
He called for it, but when he was written to, he didn't reply.
By who?
By the party leader of the United Democratic Party, and I can be vindicated by Dr. Sise if you had, he said it. The party leader wrote to all the political parties and the state to put heads together, sensitize the Gambian, because some of the, it is very important for people to understand the system of governance everywhere in the world and democracy. There are certain people, they tend to listen more to their political leaders, religious leaders and mentors and their idols than even the government. Yeah. So when you have an issue like Senegal, when it started, Macky called all venerable religious leaders plus political leaders who has influence in society and discussed the issues they should tackle COVID-19 with in Senegal, and it was very effective. Because if Serigne Touba's Khalif right now has to give ndigal, the Murids in Senegal will always adhere to that. If the Nyasen, the Khalif general there, will talk to the Tijanias, they will listen. Well, if the Lions, Khalif talk to them, they will listen. This is what we're talking about.
Yeah, we don't have the same thing here.
We don't have the same thing here. Why? It should be leadership. And you don't have that. Now you have the political leaders reminding you, this is what we can do. Okay. Let's come together and fight this thing. Holistically, we have a holistic approach to this issue so that Gambia can be safe from COVID-19. Okay. You didn't reply, you didn't act swiftly, and it's only the political and society, civil society groups. Okay. They're giving out liquids, they're giving out face masks to reduce the burden on the poor people.
All right. Now,
but Dusano actually questioned the role of the civil society.
No, if he discusses that, we here, especially me, I will not answer that. Because the sensitization starts with civil society groups. There are pictures, people have their archives, there are videos showing different civil society organizations and distributing face masks, bleaches, buckets for people to be washing, sanitizing before it even out like this. Okay. So people like him as a presidential advisor, to be a nuisance as a presidential advisor is the most pathetic thing. The Gambia is in a very pathetic state because of people like Dusam. Okay, you don't even understand what you're saying and where you should say it and how you should say it.
Let's come back to the president's statement. Anyway, that's fine. Now, Nyauru, of course, listening to what you said, it's similarly understandable. You are the least happy with the government response of the COVID-19 fight and all that. But overall, if you should look back from March to now, what would you look at least and say, this government have done and what's commendable?
Definitely, speaking from my heart, I don't have any.
Like seriously?
Like seriously. I don't have any.
All right. That's fine.
Like seriously? I don't have any because I've not, you said, like for you, your colleague have said, even the restrictions you're talking about, the restriction, just saying it merely and implementing it, this 45 days extensions and extension we had, it's not that important. What is important is the implementation. Of those regulations. Right. If they are not implemented, you just say regulation, even face masks. Like he said, it's more of chin mask than face mask. Okay. Some people think it is just
put it
on because the law says we should. No, because you should sensitize. I said the civic sector of the civic education unit of the Gambia government should do a lot when it comes to COVID-19. Okay. That they should be informed that this is a thing. All right. They should not have the fear that they will all die when they contract the disease. But they should not also think it's not non-existent and it cannot do anything to them.
Finally, before we go...
That's a responsibility.
Yeah, indeed. Finally, of course, today is the 17th of August and we have over 1,000, COVID-19 active cases. What do you expect from government henceforward? And of course, generally from Gambians as a country, because increasing by the day, and this is again calls for national unity to fight, but more so to government. What do you expect after the president has spoken to the Gambia for the 6th time since the outbreak? What are you looking forward to? What are your expectations from now on?
My expectations will be whatever the government does, let them think about how to help the crippling health system and the strenuous system we have in our health sector by boosting and encouraging the frontline workers. They are just on time. That is called moral impetus. It will always encourage them to go to the extra mile, even they contract. But imagine a nurse on duty that who has contracted coronavirus is in an isolation center. The Nurses Association have to buy food stuff and medical stuff like Dettol and things for them when they have been sent to quarantine by the government. Is that telling well on the central government? Okay. And hearing all the monies that have been spent Minister of Finance, I think it's a joke. They should not joke with people's lives.
Okay.
This coronavirus is real, and I'm advising all Gambians. Let us not do it for anybody. Let's do it for ourselves, for our brothers, our sisters, and our family, to stay put and make sure we adhere to all the WHO guidelines. Observe the most stringent measures when it comes to self-cleanliness and hygiene. Stay at home very well until if it is seriously necessary for you to go out. If it is not necessary, go out, and make sure the government also should sit up with the experts and discuss how to cope this COVID-19.
Thank you very much. Thank you very much, Nyauru Koma, a regular contributor to our program.